The next sexual problem we'll look at is erectile dysfunction, and this is perhaps one of the most commonly known male sexual problems. And believe it or not, it is also rather commonly experienced. 20% of men over 30 have had experience with ED. Erectile dysfunction is when a man is unable to achieve or maintain an erection firm enough for intercourse. And in order to understand ED, it is important to understand how an erection occurs. Now, I know what you're thinking. You touch it, or it just happens, right? Or it's not the case. It's important to understand how an erection occurs, and it all begins with stimulation in the brain. This stimulation occurs through the optic nerve. First, I should tell you the brain is the largest sex organ, and this optical nerve, which allows the stimulation in. This is why, if you've ever heard me say that men are visually turned on or that men respond to what they see, it's because their brain is stimulated through the optic nerve. When this happens, all sorts of chemicals are released that signal to the blood to enter the penis. These chemicals keep the blood in the penis until the stimulation ceases and ejaculation has occurred. And it's interesting that ejaculation, and you probably don't know this, but ejaculation and orgasm are two different events in a man. Men can orgasm without ejaculating. This is possible, and some men train themselves to do this so that they can experience multiple orgasms. Once ejaculation happens, the blood leaves the penis and it becomes flaccid. And there is a recovery period before this cycle can begin again. This is called the refractory period. And it's important to note that the refractory period lasts different amount of time for different people. And this period of time that the refractory period takes place can be longer depending on the person's age. For an older person, it could even last an entire day. So it's important to understand that if an older gentleman comes in and he is reporting that he is unable to achieve an erection, but he had sex 12, 16 hours beforehand, then he does not have erectile dysfunction. In fact, for any man, occasional problems with erections do occur, and these are not classified as ED. Gentlemen, I want you to listen to me. Gentlemen, listen. You are not a machine. I know you like to think of yourself as a machine. You like to think of yourself as invincible sometimes, but there are glitches that sometimes happen in your body. Just think about it. Sometimes your knee gives out when you're running or you're on the treadmill or you're working out. You have trouble turning your neck sometimes. If your neck is stiff or whatever. You don't have a major crisis. If you can't remember someone's name or the title of a book that you recently read, this doesn't mean you have dementia. These are just glitches that takes place in everybody's body. These are normal. You are only human. These are normal events for everyone, and they happen occasionally. And it's the same with erections. Now, there are a number of causes for ED, including diabetes, cardiovascular disease, MS, cancer, medications. If you are a bike rider and you cycle often, you could compress the nerves and capillaries, making it hard to get an erection. There are also psychological problems that could be the cause. This could be performance anxiety. A guy could be worried if, he can get an erection the entire time. And this could make it even harder for him to achieve an erection because instead of focusing on the stimulus and what he's feeling and what he's seeing, he's focused on his thoughts of worry. He could also have negative thoughts about sex. He could think that it's wrong to have sex or feel guilty about it or something like this. He could be in conflict with his partner. It's hard to be turned on by someone who, you don't even want to be in the same room with them. And of course, depression can be a cause. There are 3 levels of treatment for erectile dysfunction. The first is pharmaceutical intervention, and you've probably heard of medications like Viagra and Cialis. This is the first step of treatment. The second tier includes injections in which a man can give himself a shot in the penile area, which allows him to achieve an erection. There's even a vacuum device in which a man can insert his penis and pump it up until he is erect. And then he can place a silicone or plastic ring at the base of his penis to trap the blood. It is important that it's a silicone or plastic ring that is easy to come on and off, or else this could be painful and cause some problems for the male. Finally, the third tier is penile implants. These are available, but they are a third tier treatment. And while it is helpful for some people, others do have complications with it. And if there is some type of infection and has to be removed, it cannot be replaced.